Hi, I'm Colin Hung, CMO and editor of HealthcareScene.com. We are a network of blog sites, and we've been around for 12 years and published over 12,000 blogs on a variety of topics, including much in the health IT space. I'm here today in the Windstream booth to talk with the good folks here about their work in this new space. Windstream's not a new company, they've been around for a long time, and they're helping organizations connect and collaborate more effectively. So Tony, let's start with you. Tony, CEO of Windstream, welcome.
Thank you. Thank you. It's good to be here.
Yeah, we're going to have a lot of fun today. So Windstream's not a new company. You guys have been around for a long time. You've been very successful in the retail, banking, and other industries. Why the push into healthcare?
Well, when you look at the success we've had in retail and banking, and you look to where healthcare is headed, the commonality is the push to technology. It's the technology transformation that's taking place in retail, in financial services and fintech. And when you look at healthcare, that same sort of evolution with technology is changing, how healthcare gets done. The focus on the patient experience, the focus on cost transformation. So it's just a natural kind of outcropping of where we've been headed, and given the opportunity we see in healthcare, we're increasing our investment there. We think we can be a provider of choice for a lot of healthcare companies.
Very cool. Now, we're here at HIMSS, lots of interesting technologies around here. I know lots of these technologies you're involved with. We got AI, got machine learning, got all these great things. What's sort of standing out to you? What's important to you?
Yeah, I think when I look at it, it's all about the application of technology to challenges in healthcare, whether it's the patient experience or in terms of cost transformation. My personal favorite right now is AI and machine learning, just because the application of that to some of the digital changes that are taking place are really impressive. And what you see in that is just the constant need to make sure you keep your network front and center. As you go through a technology transformation, you have to make sure you have your network capabilities aligned to where you want to take yourself from a technology perspective.
Interesting. Let's explore that a little bit more. So you're saying infrastructure is very important. And why is that?
Yeah, I think what we've seen in other transformations, whether it was retail or government, sometimes the network was an afterthought. And when you're going to be potentially pushing much more data, having a more cloud-centric approach to how technology works, the network has to be front and center. You have to have a strategic plan around your infrastructure.
Excellent. And so you were just here on a panel talking about digital pathology. I got to admit, I had to look it up, but very interesting. Why that space? Why did you get involved in that space first?
And obviously we're here with the University of Kentucky Healthcare. And the reality is very similar to the challenge that they had. We help our customers solve the critical business issues they have. This was a challenge the University of Kentucky Healthcare was faced with, and we were trying to work with our customers to find a creative solution to this massive amount of data that now is flowing over their infrastructure. So digital pathology in some ways comes through that collaborative conversation you have with customers. When you're a trusted advisor, you're working with them to solve their issues.
Excellent. Excellent. And that's sort of a nice segue over to Dr. Cody Baumgartner. Welcome.
Thanks.
Dr. Baumgartner, can you sort of give us an idea of what you do and what organization you're with?
Well, I'm with the University of Kentucky. I'm a trained computer scientist. I'm not a pathologist, which kind of speaks to the changes that are going on. This probably wouldn't have happened 5 years ago. And then trying to bring in biomedical informatics with pathology, because pathology arguably provides the pathological report provides arguably the most actionable data in the patient record, and it's relatively low cost compared to other things. So a lot of opportunity there.
And why do you think digital pathology is really kind of taken off?
Well, you have to think of what pathology is, and it's a collection of lots of different points of data. Some of it's image data, some of it may be genomic, and a lot of it's laboratory data. So you had laboratory data was some of the first computation in the 50s and 60s that you even had in healthcare at all, where the other systems were more for billing. This was more for laboratory and information management. So bring in with that, when you look at biomedical informatics, which is the processing retrieval of data, you have the data generator and then the people doing the sort of inference and computation on that. So it's a natural space. So what we're taking is pathology data, making it in a way that is both operationally more effective, but also something that we can compute and make sense of from a computational perspective.
That's excellent. And how long have you been doing this digital pathology thing?
A lot of it's ramping up on the image space, but we, from the research side, we did a lot of genomics work, clinical genomics work. I've done over 4,000 clinical runs, and that started when I was on the research side, and then joined the clinical faculty this year or last year. So a couple of years. Been a couple of years we did 4,200 genomic runs, which is basically generates about 1.2 petabytes of data.
Wow, that's a lot of data. That's a lot of data. No wonder the need for infrastructure. Talk to me about how that got started. If someone's thinking about getting started with digital pathology, where would they go? How would they get going?
Well, there's probably several modes of thought. I mean, a lot of vendors would say just buy our suite of products and we'll take care of it. But a lot of it has to do with where you are currently, what the culture happens to be, and then where you want to go. In our case, we have a group of faculty, bioinformaticists, computer scientists, and then supporting staff to try to figure out, can we make double use of the data? So there's some operational efficiencies, say of scanning slides so that you can remotely view them and make some diagnosis, but there's also some operational research opportunities. So if the data is annotated in an appropriate way, we can use machine learning techniques to maybe cut down on the time that it would take a pathologist to make a diagnosis or even do anomaly detection, things like that.
Excellent, excellent. It's time to introduce our final guest here. Jan, we saved the best for last. So, Jan Bates, you are the Systems Operations Director at University of Kentucky Healthcare, and you were on the panel with these two fine gentlemen around digital pathology.
Right.
So, tell us a little bit about yourself.
So I'm Jan Bates, and I have the Systems Operations Director. That's made up all the infrastructure. So we have networking, infrastructure, platform as a service, our storage team, and all of our data centers are in that area.
Excellent, excellent. So we were just talking about some of the things that you can do to get started around digital pathology. Why don't you comment on that?
So I think one of the things we talked about yesterday, I like to look at history. So in the 90s, radiology went digital. And so what I wanted to do was review how much our growth in radiology when it went digital, what did that look like? And we really saw an enormous growth over the last 4 years in digital radiology. So I think as we look at digital pathology, we're going to have to see how we can segment that and grow it year by year so that I don't have to count for all of it in 1 year, because that's going to be enormous cost and funding for the infrastructure if you did it all at once.
One of the most interesting parts, I think, of Jan's presentation yesterday was this graph with the amount of data that's being digitally created, and it's almost on an exponential curve, and that's before you get to like whole genome sequencing. So, the critical infrastructure that Jan maintains has already been stress tested, and there's yet more to come.
So I gotta say, like, infrastructure, when you first think of it, is not sexy. It's not the most sexy topic, but very vital.
Kind of hot.
Well, literally and figuratively, I'm sure, the cooling of it. But how did you keep it top of mind? How do you keep infrastructure at that top level? Because it's so important to what you're doing.
Well, it is hard to get that with your senior executives, right? To show them what the risk and the benefits are of the infrastructure, because a lot of times that bores your senior executives. They don't want to hear about it. So I think it's up to me to relate that to the business, to show the value and the benefits the business will receive when we keep the infrastructure up to date in a secure platform, and that I'm watching these technologies as they mature so that I can benefit the whole business and be able to deliver the digital pathology and the other items that are on our strategic plan.
Excellent. And let me ask, in your journey, both of you actually, in your journey, as you sort of looked at your infrastructure providers and the partners you could potentially have, what were some of the things that you looked for when you looked for a partner in this space?
Well, one of the reasons we partnered with Windstream is our business continuity plan, and we have a co-location facility with Windstream. So I would say that Windstream is our technology partner, but more than that, they're more of our strategic technology partner. So I can share our strategic goals with Windstream, and they can help us achieve that high availability across those two different data centers.
Excellent. Dr. Baumgartner?
Yeah, so I think a lot of it, when you're doing research, there's a lot of stuff you can kind of do on your own, and then when you move over to clinical cases, there are reams of paperwork that you have to do to make sure you keep yourself out of trouble. So having an established partner that that you can trust and deal with security and performance, and that's really where a Windstream and other providers like that really help.
Right. So to turn the question around a little bit, what made it exciting to work with a forward-thinking organization like the University of Kentucky?
Well, one of the things that's exciting about working at the University of Kentucky Healthcare is that, the IT organization, Jan's team, has a seat at the strategic table. The university and the healthcare system understands the importance of infrastructure to achieve the great things that Dr. Baumgartner is working on in terms of digital pathology and others. That sort of strategic planning and that sort of forward thinking and recognition that technology must be met equally with infrastructure and network connectivity and evolution of how the business gets done is what makes it fun to work with the University of Kentucky Healthcare.
Clear. That's amazing. That's amazing. It's amazing. It's clear to see you guys have a very collaborative relationship, which is amazing to see here. So, again, looking around, we're at HIMSS. This is sort of the epicenter this week of everything healthcare technology. As you walk the floor, as you've kind of been to the sessions, what's sort of standing out for you? And then based on that, how do you see you guys moving forward?
I'll go first.
Sure, go ahead.
So one of the things I think, since I'm the operational director, I think about how am I going to keep this secure environment and going. So I think security has been one of the major themes that I've seen here at HIMSS, and one of the things that we're concerned with. How do I keep my patching up to date and provide that secure environment?
Dr. Baumgartner?
I would say in every booth you go to and everybody, that there's some new device or some new system they're generating or analyzing data. So I think one of the biggest challenges that you're going to have is, as this is being generated, one, you have to have some fundamental infrastructure to allow that data to flow and be able to store and retrieve that data, but also the distributed computation that's going to be involved in aggregating and making some inference closer to the sources of data generation. And I think maybe next year or the year after, you'll probably see a lot of push towards how do we deal with pervasive computing in the healthcare space and security around that, and really more of the really pushing out the computation to deal with it.
Excellent. Tony?
Yeah, what I take away is the innovation curve within healthcare is really starting to accelerate. While you go to the booths and you get a chance to talk to everyone here at HIMSS, what I take away is we're really just getting started on what could be really a historic time for healthcare, and how healthcare is going to get done is going to change dramatically, in a very short few years. And if you're thinking about it in that context, you need to be prepared for what's going to be coming next.
Excellent. Well, this has been a fantastic, very educational discussion today. I want to thank Windstream for having us and taking the time today to speak with us. It's been great. I look forward to coming back next year and kind of catching up with you guys to see how much further you've taken it.
Thanks, Colin.
Excellent.
Thank you.
Thank you for your time.